Great. Well, good afternoon, everyone. Welcome to today's Indiana chapter of ACHE, the Indiana Healthcare Executives Network virtual panel discussion. I'm Phil Schaefer, your session host with the American College of Healthcare Executives National Office. We're so glad all of you are here. There's been a tremendous response to these programs, so we really appreciate your engagement this afternoon.
Thanks, Wendy.
Hi. Before we get started, I would like to go over a few items to help navigate through the program of our virtual environment. Following today's live session, be sure to log into the Learning Management System housing for today's virtual course and complete the evaluation. Any handouts for the live session will be posted in the live session section in the course under Resources tab within the Learning Management System. Today's session is worth 1.5 face-to-face credit hours of education credit. The credit will be applied to your ACH account, approximately 2 weeks following the end of the session based on your live session attendance and completion of the evaluation. At that point, you may view or print a certificate by navigating to the My Events section within your My ACHE and locating this course. To ensure your participation is recorded for this credit, please be sure that you're using the Zoom platform or the Zoom app and not dialing in only by phone. Also, be sure that the name that you use on the Zoom session matches your registration. Each live session will be recorded and will be available within the course in the Learning Management System within 48 hours. While the recordings are not eligible for face-to-face credit, you may view the recordings and listen to them to claim qualified education credit, which are also self-reported. To receive your credit, just visit your My ACHE page and navigate to the My Education Credit to submit your self-reported credit. For the purposes of noise control, your lines will be muted during the duration of the session unless there is an active discussion. You will have the opportunity to text questions during the session by typing your questions into the chat panel so the moderator can see. And with that, I'll introduce Chad Dilley from the Indiana chapter. Chad, I'll turn it over to you.
All right, Phil, thank you so much. And welcome everybody to our annual awards night. A little bit different format this year, but as we've all learned as leaders, remaining flexible is one of the best attributes and skill sets a leader can have right now. So we appreciate the engagement. We are really looking forward to a fantastic night tonight where we're able to honor a couple Indiana leaders and the work that they have put forth. And then also get into a really important discussion about lessons learned through our COVID-19 response. So again, thank you for the commitment and your engagement here this evening. We do have a few just kind of housekeeping items that we want to go through. And Corey, if you can throw the slides up there. First and foremost, we want to take time here to thank our sponsors. Premier sponsor with Ice Miller, appreciate the support there. And platinum sponsor, Heapy Engineering. And then we'd also want to recognize our gold sponsors, NFCare, Cornerstone, Art Design, and Cat Sapper-Miller. So we appreciate all of our sponsors out there. IHEN would not be able to do what we do without our sponsors. So thank you very much for that. Every year during our annual awards time, we discuss and we propose a slate of new board members. So if we can show that slide here, we want to show you all who our slate is for this year. And this group here will look and be on our website too, so folks can review. We appreciate this team, the team that came together with our nominations and diversity team that was able to select this. We appreciate the collaboration that went through with that and just the interest. We had close to 30 folks apply to be on the board here this year, which was our strongest engagement that we've seen. And we think that we have a great group that's going to be added here, and we're open to your feedback. So by our bylaws, this slate will be on our website for 30 days, and then during our November education session, we will do a final vote on the slate of new board members here. So with that, we are going to go into the awards segments of this evening. And Kelly Barton, I'm going to give you just a minute to have the to get off mute there. And let me know when you're ready to do that. And folks in the background, if she's not able to, if you can provide her some technical assistance. Each year we're able to honor different awards. One is our Service Excellence Award. and the others are platinum awards. So Kelly, are you able to present those awards right now?
Can everybody hear me okay?
We got you. It's all yours.
All right, awesome. Well, I think I have one of the best jobs of the night, so thank you, Chad. So first, I'd like to present our Service Excellence Award. This award recognizes an individual who has demonstrated dedication in providing exceptional service to citizens and healthcare workers in Indiana. Dr. Box was named Indiana State Health Commissioner by Governor Eric Holcomb on September 18, 2017. She brings to the role a passion for improving the health of Hoosiers beginning before birth. Dr. Box has been a practicing obstetrician and gynecologist in Indianapolis for 30 years. She started her career at Community Hospitals of Indianapolis in 1987 as a private practitioner with Clear Vista Women's Care. Since 2015, she has served as the physician lead for Community Health Network's Women's Service Line. In this role, Dr. Box built the first multidisciplinary women's center at Community Health Network. Dr. Box developed critical partnerships with area children's hospitals to improve care and decrease healthcare costs, and led efforts to ensure that low-income women receive the important free health screenings they need. Dr. Box has served on the Indiana Perinatal Quality Improvement Collaborative, which is an advisory council to the Indiana State Department of Health that is comprised of more than 300 statewide community professionals working to reduce infant mortality. Her work with IPQIC includes serving on a state task force to address neonatal abstinence syndrome, which established standards for the diagnosis of NAS and developed a hospital study to determine the prevalence of drug-exposed newborns. Not only is Dr. Box committed to improving health and wellness in the state of Indiana, she has exhibited passion on an international level through her ongoing involvement in surgical medical missions to Haiti and Bolivia for more than a decade. And we probably most recognize her name because over the past several months, Dr. Box's leadership has been paramount in the fight against COVID-19 in the state of Indiana. She has demonstrated the true essence of leadership through collaboration, tenacity, and grit during these unprecedented times. With the expertise of Dr. Box, it's only a matter of time until we rid our state of COVID-19 and we can all get back to normal. No pressure there, Dr. Box. It's an honor to recognize Dr. Box with the 2020 Service Excellence Award.
Thank you, Kelly. That's so kind of you, and I appreciate that so much. I don't know if you all know, but I got to work with Kelly Barton at Community Hospitals. So that was my first family and my first home in my work life. But this award means a lot to me. And I want to say because there have been no more key partners for me in our external partners than the CEOs and the CMOs and the data officers from all of our hospitals across the state. That type of collaboration and partnership has been absolutely incredible and far surpassed anything that I had ever seen in my 30 plus years of practice, and far surpassed anything I could have imagined. So I really want to thank you. I also want to say that it's difficult for me to accept this award only in that I am just the person representing this huge team of people behind me, not just here in my State Department of Health, but in the other state agencies that have worked so hard and come together. There are no silos right now in the pandemic world, let me tell you. It has been FSSA and ISDH, and it's been our state police and NDOT, and it's been IDEM. It has been all of us working together, and a governor and a governor's team that is absolutely, they're just dogmatic. They're absolutely dogmatic in their work. They just continuously are working to improve our response to this. They are engaged in every step of this and very, very evidence-based and data-based decision makers. And that's made our jobs from a public health standpoint much easier. So I just thank you very much for the award. Not sure that I deserve it, but I will say that resiliency and adaptability have been two very key words throughout this pandemic, and Chad's already used them tonight, so I have to echo that. Thank you again.
Thank you, Dr. Box, and we appreciate you being here tonight. So our second award is our Platinum Award, the highest honor bestowed by IHEN for an outstanding executive and member who has made significant contributions to the healthcare profession. I can't think of any of a more deserving individual for IHEN's 2020 Platinum Award than Kelly Braverman. Kelly has served on the IHEN board since 2017. During those 3 years, Kelly has volunteered countless hours to assuring our chapter offers its members the best in networking, education, and career development. In addition, Kelly's leadership in solidifying organizational success during the IHEN restructure was instrumental. Kelly began her career at IHU as a special assistant to the president and chief executive officer in 2003. She would then go on to serve in several roles at IU Health. In 2017, Kelly was appointed the president of Indiana University Health Frankfurt Hospital. Since 2019, Kelly has been serving as the American College of Healthcare Executives District 3 Regent for Indiana. She is passionate about her involvement in ACHE and promoting the importance of involvement for healthcare leaders in the organization. As Regent, Kelly represents members of IHEN. She has demonstrated commitment to providing two-way communication between IHEN members and the ACHE organization. She has represented IHEN to ACHE extremely well by sharing our interests, assuring IHEN is visible, and working to assure we are aware of all the programs offered by ACHE. She has been an incredible resource for our members interested in learning more about what ACHE has to offer or how to advance to fellow status. Kelly is a highly engaged leader. She demonstrates commitment and passion for growing future healthcare leaders by challenging young graduates to pursue mentorship relationships and to be perpetual learners. In addition, she encourages fellows to focus on the reason they are in healthcare, which for her is to provide better outcomes for patients, including ways to make their healthcare more accessible and affordable, ultimately helping them become invested in improving their own health. I took a few minutes to ask Kelly's colleagues what they would say about her. And what I heard was, we can all learn a lot from Kelly Braverman. She embodies all the characteristics you would want in an effective healthcare leader. She is compassionate and empathetic with people, yet practical and steadfast with situations and challenges. She's not afraid to admit when she is wrong and will ask questions when she does not understand. She's the type of person who's always looking for ways to grow, both professionally and personally. Kelly is as humble as she is strong. Her success was not given to her, it was earned through hard work and commitment. Kelly's leadership has been instrumental through the evolution of our organization. We, ACHE and IHEN, are better today because of Kelly Braverman, and I couldn't agree more. So congratulations, Kelly, on being our 2020 Platinum Award winner.
Oh my, thank you so much. That was a lot to listen to, and I'm very appreciative, very humbled. I did wait to open it. It was delivered. Thank you very much. It is, I'm still learning a lot from all of you, and I'm happy to serve. And Dr. Box, I've learned a lot from you as well. You've got people watching you, and you are such a wonderful role model. And just like you said, none of this, any of this is possible without all the people that I've had the pleasure of working with and learning from. And that includes my family, who I'm kind of shocked right now haven't run in and the dog hasn't come in. I'm at home right now. So just thank you. I'm extremely humbled and happy to serve.
All right. Well, thank you. Congrats again, Dr. Box, Kelly and Kelly. And Kelly Barton,
Thank you.
You're still on the line. We want to make sure to acknowledge you. So congratulations to Kelly Barton. She has previously been our chair-elect, and she actually was just given the opportunity to serve as the president of Maine Behavioral Health. So congratulations, Kelly Barton. We're going to miss you here in Indiana, and we'll plan to visit you out in Maine. But congratulations again on a huge promotion and something well earned.
Thank you so much, Chad, and I will miss everybody in Indiana. I can't tell you how much I value the collegiality as well as all the friendships here. So please come visit in Maine. We have a place for you to stay.
We'll have lobsters, right?
Yeah, absolutely.
Best of luck, Kelly.
Very good. Well, with that, we're going to transition right into the panel here. So I'm Chad Dilley. I have the honor to serve as the chair of the Indiana Healthcare Executives Network Board of Directors, and really just an honor to do that. And then my day job, I serve as a Chief Operating Officer for IU Health Saxony Hospital here in Fishers. We have a great star-studded panel here for you folks that have been on the national platform and been on the global platform. We're just really excited to bring the team together. What we're going to do here is start out with some brief introductions, and we will get right into just the panel here. So Dr. Box, obviously we have an introduction with Dr. Box with the award there. So congratulations, Dr. Box, again there, and appreciate the background information. We will go in next to Dr. McKinney, and if you can go ahead and give us a little bit of background about yourself there.
Sure, and thank you, and congratulations to all the award winners. That was very exciting and very touching to hear, and definitely all well-deserved awards and recognitions. I'm Nir Menakemi, and I'm a professor and the Department Chair of Health Policy and Management at the Indiana University Fairbanks School of Public Health. I'm also a researcher and scientist at the Regenstrief Institute here on campus. A lot of my work has been at the intersection of policy, business, public health, and medicine. And in the context of COVID-19, I had been working very closely with Dr. Box's team at ISDH to conduct the prevalence study for Indiana that has been tracking basically how much the virus has penetrated into our communities.
Internet?
Separately, we've also been working very closely with lots of hospitals and running surge models, both for hospital leaders and for individual health departments around the state. We've been also working very closely with Mayor Hochstadt's office, both on policy issues, as well as other sort of preparedness issues. And finally, we've also been working here at the Fairbanks School with Marin County Public Health Department doing contact tracing work. So I look forward to the discussion.
All right, thank you, sir. Rajin, well, let's go to you next.
Yeah, good evening, everyone. And again, congratulations to all the award winners this evening. Really well done. So my name's Rajan Bumraj. I'm the Senior Vice President for the Central Zone Commercial for Roche Diagnostics based out of Indianapolis. Prior to this role, I was the Vice President for Sequencing in the US. And prior to that, I was the head of Sub-Saharan Africa, General Manager for South Africa for the last 5 years before moving to the US. So that's my background. I'm happy to be part of the panel.
Well, thank you for being here. We appreciate it. And finally, we'll round it out with Scott. Scott, you want to give us a background about yourself?
Great. Thank you for the invitation, and my congratulations as well to the award winners this evening. I'm Scott Jeffers. I am the Corporate Vice President of Enterprise Operations and Operational Excellence at Quest Diagnostics for the company. And you know, my relationship today is very focused on Indiana, our partnership with the Mid-America Clinical Lab, MACL, and you know, a key partner in the state on diagnostic testing. I've been with Quest Diagnostics now for about 5 years. And prior to that, I actually came not from the lab industry, but more from manufacturing operations and supply chain, where I was the Senior Vice President and Chief Supply Chain Officer of Hillrom, another terrific Indiana-based company. And then also spent a little over 12 years all in operations at GE Healthcare out of Milwaukee. So again, pleasure to be here and share some of the experiences and also learn from some of the experiences in the pandemic response with this forum. Thank you.
Great, thank you, Scott. And you know, that's really what we're here, is to have a conversation about what did we learn as leaders, and what can we do to improve and continue to help impact the health of our state. So we really appreciate just having such a expertise on the panel here. And with that, we will go ahead and just jump right in. So if we can go through just kind of the timeline, and maybe Dr. Box, will start with you. Can you, from your seat, talk about the timeline of the response to COVID-19?
So Great question. You know, it seems like to me that was like years in length, but actually when I look back at the timeline, we were talking days and weeks in the initial part of this. I mean, I can literally remember the relaxed, laid back New Year's Eve and New Year's Day that my husband and I had, and hearing about the increased 44 pneumonia cases that were occurring in this place called Wuhan, China, and they didn't have a source for that, and soon they, you know, recognized that that was a coronavirus. And thinking, you know, and before, other times we've been able to maintain coronaviruses on other continents, and it really had not become a major issue for the most part in the States. And, you know, thinking, well, we're going to need to think about this and plan for it, but hopefully it won't be a big issue. As things progressed in the month of January, we actually activated our incident command the first week of February because it looked like that it was spreading, you know, quite a bit, not just in China, but other places. And I know I have a good friend who's the health officer out in the state of Washington. And I remember talking with him, and you know, he said, we've got our first case. And then they had their cases and all their deaths that occurred in Washington State in the long-term care facility, which was absolutely heartbreaking. So we knew it was headed our way. There was quite a bit of angst in that early time because of the inability to test, because there was kind of a false start with testing with the CDC. Our first case in the state of Indiana was March the 6th. And our first death was March the 15th. And I remember our first case very, very clearly, and contact tracing, and it was linked directly back to the Boston meeting that occurred where there were a lot of international individuals, and that started infection in many states across the United States. Our first PPE was delivered like March the 17th, and we pretty much were off and running at that point in time. So, you know, that was kind of the very beginning of this. And, you know, we really, by the time mid-April to late April was done, we had our major first surge of hospitalizations and cases. So it seems like it was a year's period of time, but it really was more like an 8-week period of time to 10 weeks.
Very good. I appreciate that. Raj, from a corporate perspective, you know, as a state of Indiana government perspective, corporately in a global corporate company there, what did your timeline, did similar, different, how did that vary?
Yeah, I think as Dr. Box was describing the New Year and New Year's Day, it was a deja vu moment for me as well, because it was relaxation and looking forward to 2020. But I think from a Roche perspective, it was quite interesting that, you know, our fight for against the virus started very soon after the pandemic. And, you know, when the scientists in China identified the genetic sequence around the 7th of January, immediately after that, we activated our emergency response team globally with regards to identifying ways to kind of develop an assay for the virus. And on the 13th of March, we launched the first molecular PCR-based test for the COVID virus, and then soon to be followed by the antibody tests later on. And so that really, you know, what we really learned in that time is things that normally took us years to do. In light of the pandemic and addressing that, we really showed a huge amount of nimbleness and agility to be able to break the bureaucracy and get something out that was really quality, but highly, highly needed in the diagnosis of the virus.
I think that's a great point. And we've talked a little bit about EUAs. Dr. Box, from your seat, and, you know, then Scott and Raj from your seats, let's talk a little bit about EUAs and the impact just on our overall response.
So the EUAs that the federal government put out, the emergency use authorizations, were absolutely key, and for us to be able to start getting testing available to people, have companies producing tests, and also for us to be able to start using medications like remdesivir. And some people were using hydroxychloroquine. So those were very, very critical things that made a huge difference for us as we started out. And I know it brought flexibility to those drug companies that were developing medications and drugs, and opportunities to use convalescent serum and a lot of other things.
Sure.
Yeah, I could only second Dr. Box's comments around the criticality and you know, the urgency of having the EUA process. It really opened up the door for companies like ourselves to be engaged and collaborate with the FDA with regards to the product and the insights around the product, so that we can move towards getting an EUA approved product to the market as soon as possible. And I think the dialogues were really both kind of informative in themselves, but also really focused around a greater intention around being able to provide something for identifying or diagnosing the virus. And I think that was really, really critical in that process as well.
Great.
And from a Quest perspective, being the testing entity that would use reagents and an EUA assay like from Roche, we've never seen the speed that we've seen in history to be able to launch tests. We started with our first lab developed test on March 9th. As Raj mentioned, Roche had the EUA approved on the 13th, and we were actually launching the test in 2 laboratories on the 14th because we had actually put controls and kits on airplanes. We used our own Quest Air network. I have 23 aircraft as part of my operations, and we deployed our own aircraft to within hours get controls and kits and the reagents out to our laboratories so that we could get our validations underway ASAP. We ran them 24/7, and these EUAs were absolutely critical in the start, not just for those lab developed tests that we had, but the Roche tests, and then subsequently the Hologic Panther. And since then, here at Quest, we have 6 individual EUAs, and then 13 either new or amended EUAs. So we've gone back and modified those EUAs. And then the speed of these changes, thank goodness it's unprecedented, because our ability to get to market, to get as much testing as we could out there, even though it was never enough. I think it's, there were times, multiple times, where the testing volume was just overwhelming. And as the head of operations for the company, looking at what's coming in versus what your plan is day by day, no matter how hard you work and what you bring in, and it was never enough. And that was a tough time. But those EUAs were critical to bring the capacity that we did, 70,000 tests a day within the first 60 days, 100,000 tests a day, by roughly early June. There's no way we could have done that without the EUAs and that process.
So Scott, let's dig in a little bit more just about, that volume that's got to be significantly higher than what you typically do on a daily basis. Tell us about some of the pros and cons of some of that external patient communication and some lessons learned with that.
Yeah, I think it wasn't just the external communication with patients, is also with our clients. And, we were transparent from the start. We made a commitment that we were going to be transparent with our turnaround times, and to share via our webpage, via weekly communications, which we've continued to do, to make sure that people were advised of whether or not to bring testing to Quest. Our competitors largely did the same thing. And, in multiple cases through the pandemic, it didn't matter because there weren't options for testing. And so the testing volume just kept coming in. Turnaround times did increase. Transparency was there, but obviously, we disappointed a lot of customers as well, and patients. And there were many times where, the testing turnaround times didn't facilitate the good contact tracing and all the things that, we intended to have when we launched all this testing. So as good as we felt about launching massive amounts of tests in a short period of time, it was there were times where even transparency and communication wasn't enough. And at some point, multiple times, we had to ratchet back and say, we're sorry, we can't take any more volume. And unfortunately, in those same times, our competitors were in the same boat. So a lot of people just went without testing until more testing could come on board.
Appreciate that insight there. And, we discuss a lot about streamlining communication. Communication is certainly a skill that is necessary for leadership and for organizations to be able to communicate Dr. Minikimi, can you talk a little bit about just the different data needs and then how you saw the different data needs transform into more streamlined communication?
Yeah, and thank you. So as I was hearing some of the discussion already and just kind of reliving that timeline of March and April, I'll never forget this meeting that I had, and I guess I'm fortunate as a researcher and a sort of academic to be in a position where I can see down multiple silos in different industries and been working with a lot of different stakeholders. And we were in a meeting trying to forecast hospital demand, and we've been developing these models using these modified flu surge models that the CDC had created years and years ago. And we're talking about needing census numbers. And I'm in this meeting with hospital CEOs and epidemiologists, and it finally dawns on me that no one understands that we're talking about different words here. Census numbers to the epidemiologists were the US Census estimates of how many people live in the county or the catchment area. And the hospital leaders were talking about how filled their hospitals are at any given time. And it felt like there was something to be said about, we were almost having a Tower of Babel. People were using words that in different contexts mean different things. And so, you know, hospitals were really intensely focused on figuring out what the demand is going to be. They needed to worry about staffing and PPE, and do they need to surge in place, increase the number of ICU beds? How do we get more ventilators? Policymakers, and we were lucky enough to work with many of them at many different levels, both in the executive and legislative branches, wanted to know, should we shut down? Should we open the economy? You know, how do we regionally coordinate for people and stuff and other resources? Health departments were really trying to figure out what the R0 is and the attack rates, and needing to get reliable numbers that measure the infectivity. And you can imagine that each of these different groups have to work together and each have absolutely unique data needs. And so I think it was really challenging, but to echo both Scott and Dr. Box and Rajan has been saying, it was miraculous how we somehow overcame very quickly these entrenched silos and these, you know, old way of doing things and just figured it out. You know, I can throw in even more stakeholders. Researchers were chomping at the bit to get involved, but at the same time knew that they can't interfere with response activities, but don't want to let go of the opportunity to sort of generate knowledge that might be beneficial. And then employers were trying to be helpful, but each group also had concerns that just couldn't be ignored, because from their perspective, they were absolutely existential, paramount concerns. And so despite all of that, what I feel pretty proud about, having just lived in Indiana now for 5 years, I think this is the 5th state that I've lived in the US. I don't know any state that has been able to coordinate better than we have in this state, in part because I think there's just a culture of openness, transparency, and recognizing when now is not the time to continue with our ongoing disagreements about things. Now's the time to focus on more important things that we all benefit from, and we're only as strong as our weakest link. So
that's a great point there. And Dr. Box, anything to jump in on that with that?
Well, I think that Nir said it extremely well. And I think that, you know, early on, there was a couple tiny little things that kind of came up, like turf battles, like, oh, hospitals don't want you to share their data across hospital systems, you know, from one system to another or within the region. And, oh gosh, you know, so-and-so should get credit for this data. And it didn't take long for us to say, that's not going to work. We can't have that. You know, this is a totally different time. And everybody just kind of laid it all out there. And I think transparency is a really, really key comment here, because I think that hospitals being transparent about their data and their hospital beds and how full they were and their ventilators and how their patients were doing and their data, and all of our data teams between Fairbanks and Regan's Street and MPH and FSSA and IDH, basically setting it down and saying it doesn't matter who leads this right now, we are all going to work together to get data. And then I think Nir made another really good point that I want to echo, and that is we had a group of researchers between IU School of Medicine and CTSI that stood up and said, we're here for you. We're real time going to get you data and information. And when you're dealing with a brand new virus like this, everything's a question, right? What is the most recent things about the specificity and the sensitivity of this particular test? Talk to me about remdesivir. What are you seeing with that? We had the benefit of having it starting on the coast and moving toward us. The unfortunate thing, and that was good because we did get to have some data that we could look into and use. But the unfortunate part of that was we got caught in this terrible vicious cycle of, you didn't have enough tests because the other places were so high that all the tests were going there from the federal government, CDC, HHS, which I understand. Quest was really testing more, for the coastal areas. And we couldn't get tests to even prove we were a hot spot in Indiana. So once again, if you can't get tests, you can't prove you're a hot spot, you don't get the PPE, and this cycle just continues. And it was really a frustrating thing. Totally understand what Scott says about wanting to be able to supply the needs of the entire United States. And I think what people need to remember is that as much as a pandemic can occur, everything we dealt with from a disaster standpoint before had been more regionalized or statewide, right? So the federal government is prepared and ready to come into a region or a state and help out. When you talk about every state in the United States, plus some of our territories needing exactly the same testing, exactly the same PPE, exactly the same reagents, that's just overwhelming. It was not something we were prepared for.
No, those are great points, and appreciate the commentary with that. So the conversation is about leadership lessons learned, and how do we pivot and move forward with that. And clearly, this is a global pandemic. In the state of Indiana, we're typically, even outside of the pandemic, not necessarily the healthiest state. Depending on which data point you look at, we're usually at the bottom of the pack. So I know when we look at that, I've seen some recent data from the United Health Foundation, just looking in the mid 30s, 40s, depending on which segment you look at and which element you look at there. I'm wondering if we were to look into the future, I heard the words nimble, I heard breaking down silos. That's not something we commonly hear in healthcare. And so how do we take some of these lessons learned and attack infant mortality, smoking cessation? How do we take some of this data and really attack some of the common problems that we see here in Indiana?
Well, I can start. I mean, should not have been a surprise to us that Indiana would have increased mortality rates and other issues higher than a lot of states, because as you say, when you look at pretty much any health metric, whether it's, being the 4th highest smoking state in the nation or, one of the most obese states in the nation, we have all the medical underlying comorbidities that go along with that. And that's what people are dying from, right? Being over the age of 65 and having these comorbidities of diabetes and high blood pressure and heart disease and obesity and smoking, underlying chronic lung disease. So we shouldn't have been surprised when it kind of became unmasked by this pandemic. I think your question is that going forward, and I've said to my data team several times, I said, shame on us if we ever go back to being siloed in our data. Shame on us if we don't keep this same data team going forward, working together for the state as a whole, because that has been really, really critical. And going forward and working with our public health partners, I think Indiana realizes that we need to invest more in public health, so that if you invest more in your local public health, you'll have full-time health officers. They can actually hire public health nurses. They will be able to have the opportunities to serve their communities, because that's been critical, to have boots on the ground. And quite honestly, about 1/4 of our local health departments closed their doors in mid-March, and they weren't doing immunizations. They weren't there to pass out PPE. They weren't there to be able to help get testing supplies to places. So it really has uncovered a lot of underlying long-term problems that the state of Indiana has had. So all of those need to be addressed going forward to improve the public health.
So I think as leaders here, you bring up the public health funding. This data set with the United Health Foundation indicates Indiana ranks 47th in the nation in public health funding. What are tactics that healthcare leaders can do to advocate for that?
Well,
Can I jump in there and just
please.
echo, Dr. Box, what you were saying?
Yeah.
I think it comes down to something that I think I learned in kindergarten, although I'm now told it's more of a British thing, but somehow I learned about it when I grew up in New York. An ounce of prevention is worth a pound of cure. I mean, we can either, and let me even, if we want to go back even earlier than that, what we learned in kindergarten, you know, about Humpty Dumpty who sat on the wall and all the king's men and all the king's horses couldn't put him back together again after he broke. If we just prevent the fall in the first place, the cost of a seatbelt for Humpty Dumpty is a lot cheaper than deploying all of the resources of the, you know, kingdom to try to do something after the fact. And so that message is not hard for almost anyone to understand. I think what we have been challenged with is figuring out how to operationalize that. And I think with evolving payment models in healthcare, now is the time that's, I think, bringing people together with a loud voice and who's always has had the mission of focusing on these things. I think we're beginning to align, but we need more push. We need more coordination so that we don't let this crisis, for lack of a better term, pass us by and then we revert back to the old way. Sorry, Dr. Box, I know you were also sort of gearing up to
No, I think, Nir, that's an excellent point, and that's a point that's very difficult for me to get some of our legislators to kind of understand, is that you put this money in on the front end and then you save all this money down here on the back end. But that's over years, right? And they like things that you invest in that you see changes within 2 to 4 years.
You know, if I could jump in from a commercial perspective, when you think about the infrastructure to support the healthcare needs of a state like Indiana or any state in the country, and in this case, the entire country, you know, one of the biggest lessons learned that we've had, and I think our direct conversations as a trade industry through ACLA to HHS, is that when you don't have the infrastructure, you know, to respond not just to pandemics, but respond in general to the testing needs, which are absolutely required to be proactive, preventative. If you don't have that, you don't put the funding forward, it's very difficult to get in front of any health crisis that you have. And so for companies like Quest, LabCorp, and then health systems out there that are affected by cuts over the many years, the Protection and Access to Medicare Act, PAMA, these were very difficult, impactful reductions in reimbursement rates year after year after year, where, you know, really half of the margin was taken out of the industry. You know, and it just forced the industry to make cuts similar to that, and then made that infrastructure smaller. Less labs, less infrastructure, hospital labs being pressured to outsource. It all became, you know, part of the inability to respond as quickly as we needed to. And I think that was a tough lesson learned and something we need to advocate for going forward.
Sure. Appreciate that, Scott. We are planning to do Q&A at about 6 p.m. So please, as you're starting to think through some of your questions, at about 6 p.m., go ahead and throw those in the chat feature. Over the next 15 minutes, if we can pivot a little bit, let's get into some of the unintended consequences of the response. So what are some of the pros and cons and some of the unintended consequences of our response?
So I can tell you that there were some unintended consequences, like the lack of immunizations. If Indiana, you know, when our local health departments closed down immunizations, a lot of counties, that was the only opportunity for them to get VFC, so CDC funded vaccines for children. And so we are 2-year-olds, about 47% of our 2-year-olds in the state right now are immunized, which is critical because we could have now children that are dying of vaccine preventable diseases like whooping cough in a time of a pandemic when, you know, it's heartbreaking to lose anybody, let alone from something we know we could have prevented. Our 6-year-olds, only about 78% are immunized. Our 12-year-olds, 17%, because that includes the recommended HPV, and our 18-year-olds, 44%. When we look at our MIs, you know, they were down anywhere from 20 to 40% presenting to the hospital. And when they did start presenting to the hospital, everybody that was coming into hospitals had a very high acuity rate. You probably have, you know, talked with your partners about that. And I've heard from CMOs, it's like nobody who comes in doesn't need to be admitted and potentially go right up to an ICU. They're so sick. And it was the same thing with stroke. So those are all kind of unintended consequences and situations that occurred around this pandemic, but just from an even healthcare standpoint.
Yep. Very good.
Maybe I'll, add from a corporate perspective. I think one of the unintended consequences of it is that what we learned was that the power of coalescing behind a common purpose just enables you to, in the traditional way prior to this, there was always a why things can't be done, and why a process or a step needed to kind of happen in order for something to down the road to happen. And I think in the context of the pandemic, people started saying, how can we do it? And that coalescing around a common purpose just gave people the impetus to be more forceful, more, question things more, and really move the needle to get to delivering impact faster, more efficiently, and on a wider breadth than we've ever done before. And so that's from an internal perspective, on a different angle on the consequences of what we face.
Yeah, if I could, I would second that. From a corporate perspective, the alignment that we had to solve problems quickly, to make sure that we had the operating mechanisms with the right people all the time. The daily we've had since go back all the way to mid-February, we started a daily call. We've had this daily call every single day, including Saturdays and Sundays, up until today. And these daily calls have all the right cross-functional people on. They're always at the same time. Everybody's there. And if they're not there, it's for, an emergency, or they have someone else standing in. And the ability to just drive decisions and alignment so quickly and keep everyone on the same page as you're trying to respond and support the country, and customers and patients. I've never seen anything like it, and definitely a good lesson learned, and something that I would love to replicate, in other forums later. I'll tell you, one of the unintended consequences, at least from a Quest Diagnostics perspective, because of the supply chain constraints that have been created around COVID-19, everything from pipette tips to collection devices to you name it. These supplies, and at different times there's different supply issues. These have really hurt other parts of healthcare. And right now today, hospitals, Quest Diagnostics, other ACLA laboratories, we're struggling with how to take care of women's health testing. It is really a challenge because there's just worldwide not enough, plastic pieces and parts, and it's really something that we have. We are making choices today. Do we do COVID testing, or do we do women's health testing, and how do we support everything? It's not a good situation, clearly, but it's reality today, and it continues on, even though testing volumes have declined of late.
So Chad, in terms of consequences, I think there's positive ones and probably also negative ones. The irony is we shut down in part to protect people's health and lives, but in a region of the country that's hit hard with these so-called conditions of despair, shutting down the economy basically creates fear, stress, job loss, which exacerbates an already, out of control situation with substance use, behavioral issues, mental health issues, etc. And I know we're still dealing with it, and we're probably going to be in that one for a much longer time period now because of COVID. And obviously that was not any of the consequences we were hoping for or shooting for when any of the decisions that I very supportive of were made. With that said, there's also, I think, some positives. At least for the time period when the shutdown was in effect, and this is true globally, I'm interested in seeing this in Indiana, but our air got cleaner just because less people were commuting, which means asthma probably, asthma attacks and, respiratory ailments probably at least temporarily improved. And we look forward to kind of looking at that. But, at a time in our country when we just seem to be disagreeing on a lot of things as a society, a positive, I guess, unintended consequence was all these documented demonstrations of kindness and generosity and support by strangers. That really, I think, gives us something to grasp onto, to kind of go back to how, we need to be more like that on a regular basis. And it's okay to have disagreements. Frankly, I think disagreements makes us overall better. But I think we as a society have gotten to the point where I'm not sure the level of disagreements we are experiencing is making us better yet. And so I was thankful that the COVID-19 situation rehumanized lots of us, in just every single one of us knows of someone or ourselves that either did something or was the recipient of uncommon generosity from a stranger. And that was positive.
That's a great point. I appreciate that feedback. We're very, very good. So let's talk a little bit about how we saw leaders approach work and we saw organizations approach work. When we discuss kind of the framework for decision making, talk about what you saw was most effective, and maybe spend some time on some values, some principles, some guidelines. How do you create clarity to your teams on the framework around making decisions?
I'll start from a corporate perspective. I think one of the things we did very earlier on is establish a very strong cadence of communication in a very transparent and open way internally. Is really about equipping the organization, the employees, with as much information as possible. Now that was really difficult because information was changing by the minute. And so there was no certainty in the information. So that resulted in us having a lot more communication frequency with the team in the early days, and then internally really aligning on what we needed to do. But making some really decisive calls earlier on about, we as a company, we said we want to be totally honest and transparent with our customers so that they know exactly what we can support, what we can do, and how we're going to journey in fighting this pandemic with them, as opposed to creating an expectation of something greater and then failing to deliver on that. And so those were really hard conversations because there were some really committed customers for many years with us, and we weren't able to at the very beginning, and even now, provide them with everything they needed for the demand as the demand was growing for testing. And so we had to have those really, really concrete discussions, but do it in a really responsible and accountable way. Is whatever we kind of said we would do is consistently deliver on that without compromise. And then wherever possible, to be able to increase that, consider that at that time, and then make that decision to do so, and then do so responsibly, uninterrupted as well. The other thing that I think that I saw happening in the organization from a leadership perspective is around just the empathy and compassion for the employees and the team members itself during this time was critical, because they were still the faces of the organization to the customers and beyond. And so being able to do that, really being very decisive around what we're going to do versus what we're not going to do. And, very clearly early on deciding there's never a wrong time to do the right thing, and letting that be your guiding principle to move forward with. And while addressing the pandemic that we had to kind of fight now, also looking, futuristically and say, what else can we do from a whether it's a testing algorithm or product development perspective, that's going to add value to the clinical algorithm of testing when it comes to the pandemic or COVID per se, and start thinking about how do we journey towards getting something like that done as well at the same time.
I think one of the things that I saw and I really appreciated, through a lot of the early stages and even now is, the humble servant leadership of people just fighting to break down barriers and to solve problems. I think that people stepping in to say, how can I help you? How can I? And it was not only internally, but even with our partners, our suppliers, like with Roche, like Hologic. How can we work together and figure out how to maximize testing for the country? It was an interesting time, because even our number one competitor, LabCorp, we had joint calls with HHS at a time where we were making decisions with HHS. How do we support the country in the best way? And LabCorp and Quest figuring out how to maximize the ability to bring testing to market, and saying, hey, I can't do this, can you do that? It was just, I think that humble, we're in it for the right reason. We have we have a mission as a country, that I think was really, really powerful
Sure.
throughout the whole thing.
Sure. Values-based, kind of a servant leader. Any other leadership styles? We've heard flexibility, adaptability, resiliency. Anything else from a leadership style perspective, or leadership characteristic that you thought really emphasized successful leadership during the response?
I think the one thing too that was really, really clear is the need to be humble and the humility that goes along with leading, knowing what you can and can't do, and not being afraid to reach out and ask for help. And for me, that was something that was overwhelming, to see the number of individuals that wanted to step in and fill the gap and try to do everything they could, with that can-do attitude, as Scott was saying. How can we work together as hospitals, as state agencies, as data teams, and public health across the state of Indiana to do what's best? Because a big part of what we had was, and I had to develop kind of a bird in the hand approach to things, in that I would be promised a lot of things, whether it was testing or tests or nasopharyngeal swabs or PPE, and that we just got overpromised and sometimes underdelivered. And I understand. I had to do the same thing, but I had to learn to be very humble in saying, this is what I'm expecting, but I don't know whether I'll get it, right? And I think that that's been very, very evident with everybody that I've worked with through this. It's been very rare for me to see, someone that didn't understand how humbling this whole situation has been.
I was also going to say humility, and I had a slightly different, adaptation of the word. I think, and I laugh because Dr. Box, the governor, is frequently reminding all of us that you are reminding him that it is a novel coronavirus. And the novel part means we don't know a lot. And the humility that I was sort of immediately thinking about is the leaders that were saying we don't know enough, and getting comfortable with that uncertainty. You take any issue, opening up the schools, opening up the colleges, doing it online, doing it not, the factory floors, the bars, fill in your blank. It is a complex decision that no one knows the right answer to. You need input. If you ask just the infectious disease clinical experts, they have one version of the piece of the puzzle that you need to know. If you talk to the public health practice people, they have another piece of the puzzle. And I will tell you, it's not always in agreement necessarily. You ask the employers, it's something else. You ask so on and so forth. And I think anyone, and you see this on social media, you see this in other places, that think they know the answer, I just jump in there and say, I'm a little bit skeptical, because if you know the answer, I would love to know how that information has not yet been generated by humanity. And so we're figuring it out. And I think the leaders that can be comfortable with the uncertainty and manage that, because people are anxious and they want answers and they want it the way that they want it. Managing that is where I think, people have been shining.
Very good. Well, we're on 6 o'clock here, and so if we want to go ahead and see, apologies there, Sarah Johnson, for taking all your favorite questions away there, but if we have other folks that have questions, now's the time we want to set aside for Q&A. Clearly, expert panel here, and now's your time to ask questions from local leaders and global leaders here that are with us. So feel free to bring some things into the chat feature. And I'm not sure if we'll be able to unmute yourself for that, for any questions there. Phil, you may have to correct me, or Corey, correct me if we're able to only use the chat feature.
They can unmute themselves.
Okay. So if you have a question, go ahead.
Yeah, I went ahead. You didn't take all my questions, Chad, although you're in my favorite space, as you know, around leadership. So, but it was interesting because when you ask those questions, which are very relevant, I think, because this has challenged our leadership, all of us in a variety of ways. But what I heard were some generalities about what you saw. So my question would be for each of you as individuals, what was your personal greatest challenge? How did you have to adapt from what your normal course of style would be that was toughest for you? It's personal, I get that, but I think we often look to others and say, well, here's what I saw so-and-so do, but this is a self-discovery sometimes when we get in this crisis. And so I'm just curious, your personal, if you don't mind sharing.
I think Dr. Box, you may be on mute.
Sorry. It's like, Dr. Box, you have to unmute your own microphone. I'm sorry. I'm the kind of leader that likes to be behind the scenes with my sleeves rolled up, working with my team and getting stuff done. So one of the hardest things for me was to be the face out there in front with the governor that actually was talking about what we do know and what we don't know, and why we're making the decisions that we're making, at a particular time, and how those decisions may change. And not being able to always be here leading specific things like our testing team or our strike teams for long-term care facilities, the real need to be able to kind of let some of that go, let that be organized by very competent, capable people that then kind of fed that information back to me. So this was so much broader. And I would say the other thing that's been really hard for me is that I'm a people pleaser, and to have to look my colleagues in the eye and say, I can't give you the PPE you need, I can't give you all the tests that you need to test everybody that you need to test, was and has been, still is, very overwhelming.
What Dr. Box just said right there, for me personally, one of the toughest things, and I've had to deliver bad news, throughout my career and disappoint, both internally and externally, whether it's with patients or hospitals or, to stakeholders within the company. But the magnitude and the level of, we intended to do this, but we only got this, and being able to communicate that in a transparent way, a humble way. I'm sure everyone on this forum doesn't like to fail. I surely don't like to fail. But in the case of responding to a pandemic, when a lot of things are out of your control, and not everything goes right, you end up failing a lot. And for me to communicate on a regular basis, this didn't go to plan. Here's what we're doing about it. That was uncomfortable and stressful. And being able to be comfortable with it has been a really tough personal learning for me in particular, and I think members of our leadership team as well.
Yeah, Scott, I think you make a great point. And just to add to that, I think just the mental strength of being able to continuously go through that is, during the time of the pandemic, it was totally kind of underestimated of what you would need mentally and emotionally to get through that. And just finding solace in the fact that you're doing the best you can, even though it's not delivering on everything that's needed. And just being able to say, let's do that, and keeping that conversation. I know with my team directly, just kind of having that conversation and being there to support them in those really challenging, difficult discussions, which sometimes is repetitive and sometimes, continuous as well. I think emotionally building that stamina to be able to do that was something that I really struggled with, but came to terms that I needed to do for myself and my team as well.
And Sarah, thank you for the question. I know you probably know this about me, but I like being around people. For me, I think I underestimated what an effect it would have to just not have that. Our team that I guess are in my department includes probably close to 50 people. And I walk around, I take the pulse of just people's posture. I probe them at meetings just to make sure they're okay, like kick the tire, so to speak, just to see that, what do they need? How can they need, who's bothered? I usually meet with everyone and say, I have two questions. Who's bothering you and what's bothering you right now at work? My job is to make those problems go away if we can. And just sitting in the house and doing Zoom and having to schedule everything, and like the lack of spontaneity, the lack of that connection, I don't think I realized how much I crave that and how much I identify, and frankly, how much of my skills that I am proud of are tied into that context. And so I have struggled just, with not having that.
Yeah, I think those are all great points. I think for me, the overarching piece would be, I like to be realistic and honest, and also a bit optimistic as well too. And so as we're going throughout and we just don't know, being honest about that, and also trying to inspire a little bit of optimism. I think that was probably one of the personal challenges I had, because there were times you just didn't see a light at the end of the tunnel. The speed of the pack is determined by the leader, and you gotta remain positive for your team. I think tactically there were some things that were challenging as the CDC guidelines changed, and we're adapting to the CDC guidelines changing. To retain that credibility as the communication piece, to say this is the new PPE guideline, or whatever guideline you want to put out there. The change fatigue was really difficult in maintaining credibility as a leader, that there's a handle on this. And I would say personally also too, the visitor restrictions, when we really tightened visitor restrictions because of PPE shortage, our intent was to minimize the spread of COVID-19 and to retain our PPE supply. And when you look patients, families in the eye, or you look them in the eye, it can be a little bit difficult when they're not able to see their family member. And I think that was one of the more challenging times for me too.
Thank you all for your transparency. That I think we failed to forget that it impacts us individually. And so thank you for sharing that. I think that's good for all of us to hear, because we all feel it, but I think it helps to talk about it. So thank you. Appreciate that.
Good question right out the gate there, Sarah. Appreciated that. Anybody else have any questions? We'll go ahead and pause here in case somebody is not getting off mute, or if they're still typing in the chat feature there. Any other questions from the group here? Okay. We'll just give everybody just a closing remark here then, if we're not. So it looks like Tyler's got a question. So Tyler's, as a leader, how do you maintain a culture that supports team members who struggle to be at home full time? This is building off of Dr. Menakemi's point, when there's no chance for these encounters. Great question. So kind of the remote work environment and adapting to that is how I interpret that question.
So I guess I'll jump in there. And so one of the things I quickly noticed, and many of you have had the same thing because many of you have told me this, the long hours at your home computer means your day never starts and never ends. Like everything just blurs. And so one of the things that I started doing was just come to the office. It was closed, there was no one here, but I knew when the start of my day was and I knew when the end of the day was. And I just felt like I was instituting some controls that when I left the office, I was gonna go home and spend some time with my kids or my wife or my family and not be at work. Something that I think when you're at home round the clock and things are coming in and you're putting out those fires and you're dealing with things, you can quickly get to 10 p.m., 11 p.m., midnight, and not even realize. And so at one point I was driving back and forth just to use the office so that I have a commute so I know when I start and end. But then that sort of compounded the fact that no one was here and that was making me feel lonely. So I haven't fully figured it out, but I keep trying.
I think in addition to what you shared, Neera, I think the other thing that we needed to do as an organization is it gave us the opportunity to really actively listen to our employees, particularly now that they have to work remotely on an extended time basis, and really see what are the kind of challenges that sometimes some may take for granted, but others may be challenging, whether it's elderly care or childcare, etc. And really see as an organization, what is it that we can do to ease that for the organization. And the other thing around the extended working hours, true. I mean, you're sitting in front of your computer, probably on a Zoom or a Hangout call on video for 12 to 13, 14 hours a day. And it's taxing. And so, you know, one of the practices that I established with my team is that, you know, no emails and contact after a certain time, and really held myself accountable to doing that. Unless it was truly essential, I would call someone, but never try to kind of get an email response or a text message after a certain time. By behaving in that way, trying to kind of lead by example so that they also start to practice that with their teams as well. It works sometimes, but at least not all the time, but it does work sometimes.
This might sound a little bit simple, but it's effective. We had a culture, or we have a culture where there are a lot of remote people across the country, and so when we're having meetings, there were a lot of in the past, before the pandemic, teleconferences, but no one really would get on video. We had Skype, we had, you know, all the technology, but people just wouldn't get on video. And you know, one of the things that we did just to make it feel a little bit more connected for those people at home is to have a policy when we're going to go on this Zoom, we're going to be on video. And as a team, when we do our staff meetings, we're on video. When we have, you know, all operations quarterly town halls with hundreds of people, the speakers are all on video, and we just make it more personal that way. We didn't start out the pandemic that way, and we quickly realized that anxiety was going up, stress was going up, and so this kind of forum where you're actually seeing someone's face, you're seeing, I'm using my hands, you know, you're seeing natural discussions. It made it real, and so whether it's a one-on-one or you know, any other kind of forum, I've really tried to demonstrate, and my team has demonstrated, let's get on video and let's make it a little bit more real, and it just makes it like we're still a team.
I think my team, Scott, that's excellent. My team really helped me with this because my AA Tammy would say, oh, you're going to have you know, a video chat and conference with your maternal mortality committee or with your infant mortality or with your lead division. And I'd be like, I don't have time for that right now. I've got this, I've got that. And she goes, no, we're going to do that. We're going to touch base. And it was so rewarding to me to be able to see my team face to face, to talk about something other than COVID-19, and to know that public health in other areas was still going on and still important. And they asked me in a couple weeks ago to do an all town hall meeting very similar to this, where I had just some of my ACs in the room with me. And I was like, oh, guys, not now, not right in the middle. And they're like, yep, that's what we need to do. We need to get in front of it. And it was so heartwarming. The questions that we got, the fear that I heard from my employees about coming back, which I had seen with teachers and healthcare workers and every other thing, but I had dismissed it or underplayed it with my own staff and my own people who would be coming back, was so real and so clear to me that it really just helped me to reconnect with them. So really my team helped me a lot with that part of this.
Yeah, it's a great question. And I don't have a ton to add on top of that. Those are all good points. I think the only piece there is, as a leader, how do you show appreciation? So I know for my admin, we share her here at the facility, and we just randomly catered her lunch one day, or had lunch delivered to her day from one of her favorite spots. So just if you have that personal connection with somebody, just a little sign like that to show appreciation, I think is another piece there. So great question there. Another question came in. So CMS just issued new COVID-19 reporting rules for hospitals. Can we talk a little bit about the experiences of working with and collaborating with CMS and other major regulators through this time?
I think that, we have had so many phone calls with CDC, HHS, FEMA, CMS, and they've been just like us, struggling to try to figure out what the right recommendations, what the right guidance is. But it, this pandemic has clearly shown us that the fact that we do labs and we do tests and we don't put down an individual's race and ethnicity, and we don't give any more other data, just made it impossible for us to have a lot of the really, really critical data that we needed going forward. CMS has really helped us to work with our long-term care facilities to make sure that they understand that when you have high community spread, you're going to have to test your employees as much as, every week going forward, so that we don't infect more people. And them coming out and supporting those things has been really, really critical. I will tell you that they've had the same problems that we've had, and that is that their recommendations have changed based on where we are in this novel coronavirus. So I think that their partnership has been really, really critical going forward and in the past.
Great. Any other questions out there?
If I could, I'll jump on that last question just a little bit more. From a corporate perspective, direct connections with CMS, HHS, and in the early stages when we were creating drive-throughs, we ended up partnering with retail drive-through partners like CVS and Walmart to actually create improved processes. But early on, every night, starting at 10 p.m. Eastern, we were on the call with a combination of FEMA, HHS, the public health group, the task force in Washington, and we were actually designing out the processes to do these FEMA drive-through sites. And it was, everything from how do you create a requisition that's going to work for both LabCorp and Quest and anybody else, and how do you do this? It was really critical from the start. And then just to be a little bit transparent, when it went from kind of a national focus to a state focus, now we had to create 50 state type processes. And it was literally chaos for companies like Quest and others to support what the states wanted and to provide testing. So it started out good, got a little crazy, and then now we're back in these regular conversations with HHS and CMS, whether it's on reporting, on a supply and prioritization, and I think it's good, it's healthy, and I think we'd have a lot of missteps and miscommunications if we had not had that direct linkage and continue to have that direct linkage with CMS.
Very good. We may have time for one more question here. Do we have one more question from the audience at all? We'll give it time for a chat to come in, or if somebody wants to pop off mute. Okay, I'm not hearing anything. So want to go through, looks like there's one more. Is there a leadership quote that the speakers can leave the forum with regarding their experience with COVID? So anything, I think this is a great just kind of parting advice. What would be your lesson learned? And we can go Dr. Box, Dr. Menakemi, Raj, Scott, and then I'll finish this off here. But what's your parting advice?
So for me, my parting advice is to always be transparent and honest with everything that you say. Tell them what you don't know, tell them what you do know, tell them what you are going to do, provided you have the capabilities to do that. And that's probably been the most important thing for me. And you know, that's one thing that American State and Territorial Health Officers really drills into us, is the importance of not overpromising and not telling them you have all the answers, but being transparent and very clear and honest in your communication.
I think of an old African proverb that I once heard that somehow seems even more relevant today. If you want to walk fast, walk alone. If you want to walk far, walk together.
Very good. Raj?
Yeah, for me, I think it would be find your purpose. Because I think with purpose, you're able to overcome anything and everything. And I think the impact that you can have around that purpose is much more rewarding, both personally, but from a societal perspective as well.
And I guess from my perspective, you know, the quote that really comes to mind is, you know, healthcare is a team sport. You cannot provide healthcare without the teamwork, not just internally, but externally, in order to bring solutions fast and to support patients for anything. But healthcare is a team sport.
Yeah, no, that's great, and great advice. My piece would be healthcare leadership is really about service. It's about service to the community. It's about service to your team, and you have to serve your team well in order for your team to serve the community. And that's the philosophy that I try to approach it with. And so that's what I would part with. In order to be a great healthcare leader, you got to serve your team well. And it's not about you. It's about what you can do to remove barriers for your team and cast a vision for them and make sure it aligns. So that's it for tonight. This was an excellent panel. I really appreciate the expertise here. Again, local leaders, national, global leaders here. So I really just want to thank everybody for the time that they put in. We also, again, want to thank our sponsors. So if we get a moment and throw that slide back up, Corey, really want to make sure that we thank Ice Miller as our premier sponsor, HEPE Engineering as our gold sponsor, Inn of Care, Cornerstone Art Design, and Kat Sapper-Miller, excuse me, they're our gold sponsors. HEPE was our platinum sponsor. So with that, that's what we have for tonight. Again, thank you so much. Thank you for your engagement. And we really appreciate all that you do for IHEN, and we hope to see you at our November event. Please follow us on LinkedIn, Twitter. We're on all the social media channels, and we're going to be asking for your feedback going forward. We want to know what we can do to better how we serve the local healthcare leaders. So please give us your feedback, as we're going to be asking for the voice of the customer. And we would really value that to make sure that we're adding value to you and your membership here. So with that, we'll sign off, and everybody have a great evening. Thank you very much.
Thank you.
Thank you, Chad. Good night, everyone.
Thank you,
Thanks, Chad.
Today's program is copyrighted in 2020 by the American College of Healthcare Executives, all rights reserved. Thank you for everyone attending, and stay safe.